Impacts of vitamin D on health, reality or myth? Hello, and welcome back. Today, we're diving deep into an essential nutrient that's been making headlines for its impact on our health, vitamin D. In our previous video, we explored the importance and impact of vitamins on overall health. Today, we'll focus specifically on vitamin D, a nutrient that plays a crucial role in both mental and physical well-being. Is its significance backed by science, or is it just a myth? Let's find out. Vitamin D isn't just a regular vitamin. It's a powerhouse that influences your body, mind, and overall well-being. So, what makes it so important? And is the hype around it fact, or just another health myth? Stick around to find out everything you need to know about vitamin D, from its benefits to sources, dosing, and even what happens if you take too much or too little. Let's start with what vitamin D actually does for your body. It's a fat-soluble vitamin, which means your body stores it and uses it as needed. Vitamin D is essential for bone health. It helps your body absorb calcium and phosphorus, which are crucial for strong bones. Without it, children can develop rickets, and adults may face conditions like osteomalacia or osteoporosis. Muscle strength. It supports muscle function, reducing the risk of falls, especially in older adults. Immune system boost. Vitamin D helps your body fight off infections and reduces chronic inflammation. Heart and hormonal health. It's also linked to improved cardiovascular health and better insulin sensitivity, which may help prevent type 2 diabetes. Mental well-being. Did you know vitamin D receptors are present in your brain? This vitamin is key to regulating mood, reducing the risk of depression, anxiety, and even cognitive decline. Now, let's talk about deficiency. A lack of vitamin D is surprisingly common and can result in fatigue, muscle weakness, and bone pain. A weakened immune system, making you more prone to infections. In children, it can lead to rickets, which causes soft and deformed bones or ADHD. In adults, you might experience osteomalacia, or softening of the bones. Deficiency is also linked to depression, mood swings, and even memory problems. Who's most at risk? People with limited sun exposure, darker skin tones, older adults, or those with conditions like Crohn's or celiac disease. Obesity can also affect vitamin D levels, as fat cells can store and trap the vitamin, making it harder for your body to use. But wait, can too much of a good thing be harmful? The answer is yes. Excessive vitamin D, typically from oversupplementation, can lead to toxicity. Symptoms of an overdose include nausea, vomiting, kidney stones, and hypercalcemia. There's too much calcium in your blood, which can damage your heart, kidneys, and bones. The key takeaway here: stick to recommended doses unless advised otherwise by your doctor. Sources of vitamin D. So, where do we get vitamin D? There are three main sources. Sunlight, the best natural source. Your skin produces vitamin D when exposed to UVB rays. Aim for 10 to 30 minutes of midday sun exposure on your face, arms or legs, 2 to 3 times a week. But don't forget to balance this with skin safety, to avoid overexposure. Food. Include fatty fish like salmon, mackerel, and sardines, as well as egg yolks, cod liver oil, and fortified foods like milk, orange juice, and cereals. Supplements. Vitamin D3 cholecalciferol is the most effective form, and it's widely available. Vitamin D2 ergocalciferol is plant-based and used in fortified foods, but less potent. Use emulsified or liposomal vitamin D formulations for better absorption in individuals with digestive issues. How to maximize absorption? Here's a pro tip. Since vitamin D is fat-soluble, it's best absorbed when taken with a meal that contains healthy fats, think avocado, nuts, or olive oil. For those with absorption issues, liposomal or emulsified vitamin D supplements can be a game changer. Also, take your supplement in the morning or midday. Avoid taking it late in the day, as it could interfere with melatonin production and disrupt your sleep. How much do you need? Now, let's break down how much vitamin D you actually need. The recommended daily intake varies by age. Infants of 0 to 12 months, 400 IU per day. Children, 1 to 13, 600 IU per day. Teens and adults, 14 to 70 years, 600 to 800 IU per day. Older adults, above 70, 800 to 1000 IU per day. If you're deficient, therapeutic doses of 2000 to 5000 IU per day might be needed for 6 to 12 weeks. In severe cases, doctors might recommend high-dose supplements of 50,000 IU once a week for 8 weeks. For vitamin D to work its magic, it needs some partners. Calcium, for strong bones and teeth. Magnesium, to activate vitamin D and optimize its benefits. Vitamin K2 ensures calcium goes to your bones, not your soft tissues. So, here's the bottom line. Vitamin D is crucial for your mental, physical, and physiological health. Get regular, safe sunlight exposure, eat vitamin D-rich foods, and supplement if needed. But remember, balance is everything. Too little or too much can both be harmful. Please note, the information provided in this video is for educational and informational purposes only, and is not intended as medical advice. Always consult with a qualified healthcare professional or your physician before making changes to your diet, supplementation, or lifestyle, especially if you have pre-existing medical conditions, are pregnant, nursing, or taking any medications. Individual needs for vitamin D may vary, and excessive supplementation can lead to harmful side effects. The content in this video is based on current research and general recommendations as of the date of publication. Viewer discretion is advised. Thank you for watching. Don't forget to like, share, and subscribe for more in-depth health and wellness content. And let us know in the comments, what's your go-to way to get vitamin D? See you in the next video.